The National Council of State Boards of Nursing updates the test plan every 3 years to reflect current practice analyses. For candidates testing on or after April 1st, 2026, the updated criteria align the licensure exam with the specific demands of modern bedside care. I'm Brooke Wallace. Over the past 20 years, I've worked as an ICU nurse, a transplant coordinator, and a clinical educator, and I am the creator of Super Nurse AI. If you want to master clinical judgment and pass your boards, hit the subscribe button below and visit the Super Nurse website for our full library of practice resources. This presentation slide from the 2025 NCSBN annual meeting outlines the upcoming test plans. The passing standard stays at 0.00 logits, and the 5-hour testing window remains. The Next Gen NCLEX format, including multi-part case studies, also continues as the primary method of assessment. Because the overall structure is retained, your current preparation strategy remains valid. Clinical judgment and core nursing knowledge continue to be the measurable metrics for entry-level competency in 2026. This chart isolates the 3 heaviest tested categories on the RN blueprint. To maximize study efficiency, focus on management of care at 15 to 21%, pharmacological and parenteral therapies at 13 to 19%, and physiological adaptation at 11 to 17%. These categories translate to daily clinical tasks: delegating to unlicensed personnel, calculating high alert medication dosages, and stabilizing patients during acute medical surgical emergencies. While the category weights are stable, the 2026 update introduces 4 specific areas of focus. This NCSBN slide shows the terminology shift to safety and infection prevention and control. The exam also incorporates modernized terms like substance misuse and adds explicit activity statements regarding digital privacy, internal monitoring devices like ICPs, and the application of health equity to ensure unbiased treatment. The 2026 plan also removes the old recommendation to spend 1 to 2 minutes per question. The new guidance is to maintain a reasonable pace, allowing for thorough reading while avoiding over-analysis. This pacing is critical for NGN case studies. When a scenario presents incomplete data, identifying the most immediate threat to the patient's airway, breathing, circulation, or neurological status provides the path to the correct intervention. Let's apply these rules. You are discharging a patient who does not speak English. To provide medication instructions, do you A. Ask an English-speaking family member to translate, B. Request a certified medical interpreter, C. Provide written materials with pictures, or D. Have a bilingual nursing assistant explain the medications? The correct choice is B. Relying on family members violates the 2026 requirement to apply health equity principles. Certified interpreters ensure accurate communication and support unbiased access to healthcare information. Next question. A patient's intracranial pressure monitor spikes to 25 millimeters of mercury, and their level of consciousness drops. What is your priority action? A. Administer pain medication. B. Elevate the head of the bed to 30 degrees. C. Suction the patient's airway. Or D. Prepare for immediate intubation. Pause the video, use your active recall, and comment your priority action below. The correct answer is B. This scenario assesses the 2026 requirement for monitoring internal devices. Elevating the head of the bed utilizes gravity to reduce intracranial pressure, addressing the immediate neurological threat. One more. A nurse posts on social media, "Crazy shift today on the cardiac unit. So glad it's over." No names or photos are included. According to the 2026 test plan, is this a violation? Yes, this violates confidentiality. The 2026 update emphasizes stricter digital privacy boundaries. Even without patient names, identifying the specific unit and timing on a public platform creates a breach of HIPAA standards. These practice questions show that success in 2026 relies on clinical judgment applied to patient safety, human dignity, and modern privacy boundaries. The 2026 NCLEX is a reflection of the complexities found on the modern hospital floor. Prioritize your study time on management of care, pharmacology, and physiological adaptation to cover the highest weighted content. Maintaining a focus on airway, breathing, circulation, and neurological stability provides the structural framework necessary to prioritize interventions correctly in any NGN scenario. Hey, thanks for watching my YouTube channel. Don't forget to like and subscribe and leave a comment. Let me know what topics you want to see more of and how I can help you become the super nurse you were born to be. I hope to see you here again real soon.